and I'm very honored to introduce to you a very inspiring colleague to us. Please welcome Paul to the stage. What to do? Let's go back.
Say hi to Daddy.
Hi, Daddy.
Look at the camera, darling.
Hi, Daddy. Seeing you soon. Hope you get well soon.
Daddy will get better soon, okay? You should ever have your head down. 6'5", 220 pounds. Hailing from rock bottom, Loserville, nothing town. Textbook version of a kid going nowhere fast. And now I'm yelling, kiss my ass. It's gonna take a couple right hooks, a few left jabs, for you to recognize you really ain't got it bad. Until the referee rings the bell. Until both your eyes start to swell. Until the crowd goes home. What we gonna do, y'all? There goes the fighter.
Champion. The referee rings a bell. To both your eyes start to swell. Till the crowd goes on. What we gonna do, kid?
Thank you very much. We should have said that this one comes with a bit of a mascara warning, I think. But, look, I know that telling this story is going to bring up a whole load of emotion for me. And if you hear me sounding as though my voice is flat sometimes, that's me just trying to control that. And I also know that when I get emotional, the effect of this injury now is that my body tightens, and I'll explain that more later. So that's why I need to sit down to tell you this story. On the 29th of June last year, early morning, I got up to go and exercise as I usually did. That morning, I chose to go for a bike ride around the Botanic Gardens in Singapore. I remember approaching this set of traffic lights. I remember them being on red. I remember seeing 3 cars stationary there and thinking that I would go down the inside of the cars. I remember seeing these drain covers and thinking, they look dangerous, I should avoid them. That's the last thing that I remember. I have no memory of actually coming off my bike. My mind has shut that out. I think what happened is that my front tire went down this hole. I don't know why that happened, but I know that the front tire of my bike was burst and that my wheel was buckled. Otherwise, my bike was okay. I know that I landed on my head here because my helmet was grazed, but otherwise, my helmet was okay. I think I probably landed on this curb at exactly the wrong angle and exactly the wrong speed, because when I regained consciousness on the floor, I could not move at all. 1 year ago, I knew nothing about spinal cord injuries. Now I know far too much. The spinal cord is the largest nerve in the body. It runs from the base of the brain to about the waist. It's like a telephone network that carries all of the messages from the brain to the body and back again. And those messages control all aspects of movement. They communicate feelings or sensations like heat or pain or cold. And they control all of your bodily functions like the bowels, the bladder, blood pressure, body temperature, and sweating. Spinal cord injuries are caused either by a traumatic injury or sometimes by a disease. In injuries, mostly the vertebrae will pinch onto the spinal cord and cause it to become bruised or swollen, or in some cases cut. After a spinal cord injury, the nervous system cannot function in the way that it did before beneath the level of the injury. Injuries are described by their level in the body and by their type. The higher the injury is in the body, the more effect that it will have on your movement and your sensation. Injuries at the cervical level around the neck generally result in tetraplegia or quadriplegia. And an injury is classified as complete if, at the date of the injury, there is no motor or sensory function around the lower sacral or anal area. If there is some sensation or function there, then it's classified as incomplete. And traditionally, the medical view was that after a spinal cord injury, the nervous system could not recover, and there was little or no prospect of improvement. Now, the view is that there is a greater chance of recovery of some function and movement if the injury is incomplete, but it's impossible to predict exactly how much will return because every spinal cord injury is different to the next. When my head hit the floor, the impact caused two of my vertebrae to slice down through the discs in my neck. They burst and put pressure on my spinal cord. The injury was at the cervical level and was classified as incomplete. At the time of the injury, I was paralyzed from the shoulders down, with almost no movement at all. Beneath the shoulders, I had no sensation throughout most of my body. I faced a risk of a lifetime of incontinence, impotence, respiratory complications, infection, and bed sores. And I was told that at the date of the injury, I had a less than 10% chance of ever walking again. Today, I'm about 60 to 70% back to normal. My telephone network is still dysfunctional. So the messages get muddled or they get sent to the wrong places. My sensation is abnormal, so in some places I'm a bit numb, in other places I'm hypersensitive. I can move every part of my body, but the result of the dysfunctional signals is that sometimes I use the wrong muscles to move. That causes tone and tightness, and that tightness feels as though my body is wrapped in a very tight rubber band, and that I'm constantly fighting against myself to move. That tightness increases when I get tired or stressed or emotional, and that's why I'm sitting down. But here I am. Today I can walk with no assistance. I'm learning to gallop and skip and hop and run. I can ride a bike, I can swim, I can play with my kids, I can drive without modification, I can type, I can write, I'm back at work, I'm beating the targets that I set for myself 3 months ago, I'm fully functional, I'm completely independent, and I'm still healing, and I'm getting better every day. And I still believe that I can get back to 100% recovery or very close to it. So why? Against all of those very high odds, why has that happened? Honestly, I don't know the answer, and I don't think that I ever really will. But every day that goes by on this journey, I'm understanding a little bit more. People have asked me whether I've been afraid, and the answer is yes, I've been terrified at times, and often in tears. I remember that before my surgery, I couldn't move my head, and my neck was bound in a very tight collar. My body would produce some phlegm, but because I couldn't move my head, I couldn't cough it out. My body was producing some liquid in my eyes that would sting my eyes. And so frequently I needed help from the nurses. I was in a private room. Because I couldn't move, I couldn't press the call button. The nurses tried to set me up with some other system that would help, but I was too weak to press it. And I remember one night, alone in bed, trying to press that button for what seemed like hours, but no nurses coming. And that morning, when my wife arrived in hospital, she found me in tears. Immediately after the surgery, when I regained consciousness, I remember being in the recovery room and waking to find all of these tubes and pipes in my nose and my mouth, and fighting to pull them out and telling the doctors that it was okay, I could do that. The gurney that I was on was facing the wall. I couldn't see anything around me, but I could hear the voices in the room. And then all of a sudden, everything went quiet for what seemed to me like a very long time, and I became afraid that they'd left me there and forgotten about me. The effect of the anesthetic that I took was that every time I closed my eyes, and this lasted for several days after surgery, all I could see were these terrifying images of black anglerfish swimming towards me with very long, sharp teeth dripping with black oil. That was the effect of propofol, which I was told later was one of the drugs that killed Michael Jackson. That stuff really scared me. But honestly, I don't think I've ever been afraid of the injury or of the prognosis. And I think the main reason for that is that from the moment that I regained consciousness on the road, I heard a very calm, very clear internal voice that told me that I was going to be fine. And I chose to listen to that voice. A very close friend of mine has told me that on the first day of the accident, when she came to visit me, and then the day of the surgery, she was amazed at how calm and clear my voice was, and that she couldn't hear any fear. And she told me that one time I looked her in the eyes and said something like, "This is not my life. This is not how it's going to be for me." I honestly don't recall ever being told by the doctors those bleak things about never being able to walk again, etc. I don't know whether or not they actually didn't tell me, or maybe I chose not to listen, and that I was listening instead to my body. And I chose to listen to my internal belief and my hope, and to choose that over the external fear and the bleak prognosis. But I know that those things were being said. They were being said to my wife, and those things have left her traumatized. When we arrived in Shanghai, when we arrived in Singapore, we left Shanghai after a period of long uncertainty. As we taxied down the runway in Shanghai, we had a conversation about our future and how it was going to be a new period of calm and hope. And then, of course, 3 days later, my wife ran into her worst nightmares, whilst also having to manage an international move and look after our 2 young children, and fighting with absolutely everything that she had to get the very best care for me. I remember her sitting by my bedside before surgery and after, and reading over and over to me something that she'd been given by a friend. And then she had these things printed in very large letters and put up on the room of on the wall of my hospital room. One of them said, "My body is healing itself. It knows what to do." And the other said, "Every day, in every way, I'm getting better and better and better." I still say those things to myself twice every day as part of my meditation, morning and night, and as part of a long series of positive affirmations that I say to myself. I've always known that I'm going to be fine, and I've known that with a passion that I've never felt for anything else. And that means that actually I don't spend time thinking much about the accident, about what happened or why. I don't spend time worrying about my physical future. I managed to stay very mindful, very much present in the current moment, now. I remember whilst I was in hospital, every day after lunch, I would breathe myself for an hour or two into some very calm, very peaceful sort of place where I felt immensely connected to everything around me, and that made me feel very energized and very motivated. There's something very spiritual about that. I don't believe in any particular deity or God, but I am now absolutely convinced that there is some universal force that binds all of us together, and that it is possible to tap into that. And if you can do that, then you can re-energize the human spirit. And through that, you can connect to the thoughts and to the prayers of the community of people who are around you. Throughout my journey, I've been supported by a very big team of medics and carers and therapists. As I've gone along the journey and reached new stages, I've been aware that I've needed a different type of person with a different set of skills or attitudes, but I've not known who they are or where to find them. One of those times was that morning that my wife found me in tears after that night. That day, she went away to find a private nurse to come to look after me in the evenings. Her name was Rita. At night, when I went to bed, I needed to have splints put on my arms to stop my hands from curling. I wore compression stockings on my legs to prevent deep vein thrombosis. I wore an inflation bag on one leg to pump the blood around my system, and a boot on the other foot to stop my foot from dropping. I needed injections to prevent blood clots. 3 times at night, Rita would wake me. She'd switch all of my equipment around. She'd give me my medication, and then she'd turn me over from one side to the other to prevent bed sores. And then she'd massage my hands or my feet until I went back to sleep again. In his book, It's Not About the Bike, Lance Armstrong says, there are angels amongst us in this world, and he has met one of them. I think I've met one too. But it's not just Rita. 6 or 7 times now during my journey, exactly the right person has turned up at exactly the right time. And I've now learned the Buddhist saying that when the student is ready, the teacher will come. I've had physio and occupational therapy pretty much every week, sometimes twice or more each week for over a year now. I've tried something called craniosacral therapy, meridian resistive stretching. I have massage, acupuncture. I'm learning to meditate, learning Qigong. I see a psychologist and an executive coach. I'm learning that this recovery is about exploring a range of therapies that strengthen and nurture not just the body, but also the mind and the spirit. I've had phenomenal support from my friends and colleagues, and I know for sure that I could not have done this without them. The knowledge that friends and colleagues have been thinking of me, praying for me, willing me on, has given me huge energy and motivation. Early on after the accident, I asked a handful of people to come and visit me in hospital because I knew that they had experienced their own personal traumas. And they came and they told me their stories. And their stories gave me huge inspiration and motivation. Some of those people are in this room today. I won't name them, but I will say a very public thank you. And of course, this is the right venue and the right time for me to say once again an enormous thank you to Diageo for the incredible support that this organization has provided to me and to my family for the last 12 months. I could not have done this without the love and care of my wife and my kids and my parents. My parents and my in-laws came over to Singapore for several months. They put their own lives on hold to come to look after me and my family. It was not an easy time for any of them, but they all tried incredibly hard to do what they felt was the right thing. My wife was amazing in those first few months after the accident, but she has now become a victim too. She's still traumatized by the things that she was told and by the impact on our lives. And in some ways, this is harder for her than it is for me. I'm the primary victim. It's my body. I can do something about it, but she is just left with the fears. My kids have been amazingly resilient, and I am incredibly proud of them and the way that they have responded to this and supported me in their own little sweet ways sometimes. Amy, my 6-year-old daughter, told me a few weeks ago that next time I go out on my bike, I should wrap myself in cushions. Those of you who've read Enid Blyton's The Faraway Tree will know where she's getting her inspiration from. My son Max is a little bit more into Ironman, so last week he told me that I should get some rocket shoes to take myself up the stairs in the house. And when we sit at home in the evenings on Fridays and watch our movies, he'll get my left hand and stretch my fingers and try to straighten them out for me. Very, very few people with a spinal cord injury at my level ever walk again, and even fewer make a full recovery. But some do. And I found their stories, and I found videos of some of them. And they are a massive source of inspiration to me. I see them doing the things that I want to do. And now I've learned that my story can help and inspire other people. I've met several spinal cord injury patients who are still in wheelchairs. And they say that watching me inspires them. They see me doing the stuff that they dream and hope of doing, and I give them hope. And that has taught me that I have a responsibility to tell this story. And I know that people without spinal cord injuries are also finding something in this story for them on a personal level, that somehow it's helping them. And that knowledge makes me feel good. It motivates and inspires me to do more. For many months, I've been able to keep my mind intensely focused on getting my body to heal and to recover, on getting my lungs to function, on getting my bowels and bladder to function, learning how to hold a spoon, feed myself, dress myself, shower, shave, go to the toilet, get my limbs and fingers and toes to move, learning how to roll over in bed, sit up in bed, sit on the edge of the bed, stand up, sit down, take one step, then two, then three, then climb the stairs, and now learn how to run. My body is still healing. It is still reconnecting my brain to the rest of my body, and that requires repetitive movement until the connections reform, and then more repetitive movement until those movements become natural again. During the course of the recovery, I've had to compensate. The weaker parts of my body, the stronger parts of my body have taken over the movement for the weaker parts of my body, and that has formed some bad habits that now need breaking. I deal with the tone and the tightness. Every morning when I wake up, my body spasms and contracts. The tightness in my hands means that some things are still very fiddly and very difficult for me, and every time I take a step, I have to think about it with intense focus. And that involves a huge amount of mental as well as physical effort, doing just the basics. So my typical daily routine is that I wake up about 6:40, I stretch for about 45 minutes. Then I exercise for an hour or an hour and a half. Now I go to work, and at lunchtime, I stretch for about 40 or 45 minutes. Back to work, I come home, I see the kids, have dinner, and then I stretch again. At the end of every day, I'm very tired, and by the weekends, I'm exhausted. But I know that all the time I'm getting stronger, I'm getting better stamina, I'm becoming more confident, and I'm continuing to stretch myself and push myself onto the next goal, and then the next one, and then the next one. But I'm also learning to listen to my body and to respect it and to know that I have limitations and to change course as and when I need to. Different parts of my life are recovering at different rates. On the emotional and spiritual side, my coach says that I've moved extraordinarily quickly from victim to survivor to thriver, and I'm ahead of the curve. But at the same time, I need to support my wife and my family. We need to rebuild our social lives, and I need to continue to re-establish myself at work. And that feels as though I'm climbing several mountains simultaneously. That's an enormous challenge. It requires an enormous amount of focus, determination, strength of mind, and willpower, or inner strength. After a year, these are my reflections. The body has an incredible capacity to heal. It's designed to do that. It knows how to. The body has its own intelligence, I think, something that's distinct from the mind, and it is possible to hear that, and that can be a very passionate voice. If you listen to your body, and if you can believe in your own recovery, you can defeat fear. If you can defeat fear, you give yourself a massive advantage, because that will give your body the space that it needs to heal. The human spirit can connect to this universal natural energy and force that is around us, and if you can do that, it will connect you to the community. You can draw enormous energy from that, and if you ask it for help, it will appear. The job of the mind, I think, is to optimize the environment by keeping yourself as much as possible in the present moment, not the future, not the past, but now, so that you can stay focused on your immediate next goal, and you can choose the possibilities and stay open and choose the positives. The mind can help by finding sources of inspiration around you, by tracking and recognizing and celebrating your progress, no matter how small it is or how slowly it comes, by trying to lock out the negatives, no matter how painful that might be, and by being grateful for what you have, and by saying thank you to everybody around you who helps you on your journey. And of course, I'm learning that my story gives hope to other people, and that therefore I have a responsibility to tell it. And lastly, I'm learning about the power of having big, hairy, audacious goals. This is the view from the top of Mount Kilimanjaro. I would like to see that with my own eyes one day. Some people will tell me I have a less than 10% chance of ever doing that. That's good enough for me. Thank you very much.
Thank you. I don't know what to say at this point. Thank you very much, Paul. It's really, it's how inspiring. It was a bit of a mascara moment. I think that calls for a break, actually. Let's just have a bit of a breather. But it's going to be a quick break, just a 15-minute break, okay? A speed break. 15 minutes, and then back here, please. Thank you, everyone.